Understanding nursing diagnoses. Learning objectives today include to differentiate between a medical and a nursing diagnosis, to understand and apply the guidelines for writing a nursing diagnosis, and to design and develop nursing diagnoses appropriate for patients in various disease processes. Prior to starting this lesson, you need to have taken the pre-quiz and to access your learning resources. The differences between a medical diagnosis and a nursing diagnosis are going to be our first topic. Your worksheet has a chart just like this that you can follow along and take notes with. So the first difference between a medical and a nursing diagnosis is that a nurse is going to create a nursing diagnosis, whereas a provider is going to create a medical diagnosis. Another difference is that nursing diagnoses are focused on the patient and the patient's response to a disease, whereas the medical diagnosis is focused just on the disease process or the disorder. Nursing diagnoses are going to allow us to structure care for that patient, and it's going to define and provide us with nursing interventions specific to that diagnosis. However, a medical diagnosis will give guidelines to the provider on what orders they should write concerning that diagnosis. Nursing diagnoses are part of the patient's care plan. A patient's care plan actually explains to the nurse how the care should be carried out throughout the day. Care plans are individualized and specific to disease processes. A complete list of nursing diagnoses are in your resources. That list has been formulated by NANDA, the North American Nursing Diagnosis Association, which is now an international group. This group has determined the need for consistent and streamlined, evidence-based nursing diagnoses so that we can take the best care of our patients as possible. There are 4 types of nursing diagnoses according to NANDA. Number 1 is problem-focused. Number 2 is health-focused. Number 3 is risk. And 4 is syndrome. So problem-focused means that we are focusing on the problem that the patient has, and they have to meet specific diagnostic criteria. Health-focused is when we as nurses want to motivate that patient to reach an optimal health situation. A risk diagnosis is when the patient is already vulnerable for developing an undesirable health condition. And a syndrome is when we have 2 or more related diagnoses that occur together in a pattern. Components of a nursing diagnosis, there are 3. There is a problem, a cause, which is also known as an etiology, and signs and symptoms, which can be known as evidence. There are also connectors related to R/T and AEB as evidenced by. So this is our formula. We have a problem related to a cause as evidenced by signs and symptoms. So here's an example. Our patient has a problem of pain, which is related to a surgical incision, as evidenced by complaints of pain, 7 out of 10 on the pain scale, wincing, guarding, signs and symptoms of pain, right? Okay, so another example could be the patient has a problem that they're at risk for infection. This is related to an inadequate primary defense. Our primary defense system is our skin. This is as evidenced by a surgical incision. So we have actually broken down our primary defense line, the skin, with the surgical incision, making them at risk for infection. The options and combinations of nursing diagnoses are endless. That allows us to be individualized and specific. These diagnoses allow nurses to plan interventions that address each diagnosis and each patient reaction to a diagnosis. The intervention part is going to be our next lesson, and I'm going to teach you how to go from this formula to planning your care through specific nursing interventions. Please complete the case scenario sheet by using this formula to develop individualized nursing diagnoses for each patient and turn that in via Google Classroom. Thank you so much.